Welcome to the latest edition of Optima Health Series. We do a Facebook Live on 10th of every month, and every month we have been having different sessions. Once we had a session on sleep, which was very well attended, and there were several questions that were asked and that was addressed. There was a session. There were several sessions on diet. There have been several sessions on immunity and autoimmunity. All of those videos are on our Facebook page, and when you do have time, please go through them. But this month we decided that we will have a session on prevention of arthritis. The reason was that we wanted to reach out to the lay public. So many patients, many of our Optima patients know what arthritis is. They are going through arthritis on a daily basis. They're struggling with arthritis, and they're doing all what is necessary, including learning about their disease. However, people who are not taking treatment, or even general public who do not have arthritis, do not have much information about this condition. So in an effort to reach out to all of them, as part of the World Arthritis Day special, we decided to have a session on how to prevent arthritis and talk about the prevention of arthritis. And World Arthritis Day is on October 12th. It is celebrated, or it is observed every year on October 12th. And the focus is to basically increase awareness about conditions in which arthritis tends to occur. So with that said, I think we can start off with the program. First of all, I'd like to introduce myself. I'm Dr. Sharath, Rheumatologist at Optima Hospital. And joining me today is Dr. Vikram, who's also a consultant rheumatologist at Optima Hospital. Welcome, Dr. Vikram.
Thank you, Dr. Sharath.
So,
glad to be here.
We'll start off with the topic immediately. Do we really need to prevent arthritis? I mean, what is the need to prevent it? Is this something that we need to discuss? Is this something that people need to know about? What is the as a lay person or as a patient, what if I tell you that, what's the big deal? If I develop arthritis, I'll think about it at that time. I'll worry about it at that time. Why should I worry about it now? Is there any logic in worrying about preventing arthritis?
Yeah, very good question, Sharath. I think that plays on most of our patients' mind, that when they see patients with arthritis, when they see patients with deformities, they wonder that can we do something so that we don't get arthritis at all? Similar to something like, to say an example, if somebody has diabetes in the family, they would think, can I do something so that I don't get diabetes? Or somebody has heart disease in the family, they might think, can I do something? When we hear people who are dying of cardiac diseases, can I do something so that I don't develop that? So that is a natural tendency of all humans, that we want, when we know that something can happen, can we do something to prevent it? And we know that prevention is better than cure. So any day. And we know for a fact in arthritis especially, that it is very important that we pick up things early, diagnose early and treat early, because that makes a huge difference. So it is very natural and very obvious that it's a no-brainer rather, that prevention should be something which we should look at in arthritis, and we should endeavor to prevent arthritis like any other chronic diseases, where we would endeavor to or try to reduce the risk of getting the arthritis. We will discuss obviously that arthritis, the factors involved are many, and what intervention we can do to prevent things, obviously it's looked at. But overall, the concept of prevention, as we were talking about, yes, we should look at put an effort to try to prevent arthritis.
So you mentioned about heart disease. Definitely everybody would say that, there's been a lot of focus on heart disease, especially in Karnataka. So we would want to prevent heart disease because heart disease can lead to death. But as a lay person or as a patient, If I was to say, what's the big deal? Why should I prevent arthritis? At max, I will have a little bit of pain. So what would your answer be
Yeah.
in that situation?
So that's a very important question actually, because when people hear about arthritis, joint pain, okay, have joint pain, I'll take some medicine, will get better. But what people don't realize is arthritis is a autoimmune disease. It's a systemic autoimmune disease. It affects the whole body, not only the joints. The name arthritis suggests it the joint, but it can affect other parts of the body. So two very important reasons which immediately come to my mind why we should look at prevention is because arthritis not only affects your joint, damages your joint if untreated, which can lead to a lot of deformities obviously, but it can affect other parts of the body like the lungs, the heart, the kidneys, etc. And say for example, rheumatoid arthritis, the most common cause of death is heart disease. Okay, so just like preventing or treating diabetes prevents long-term problems, long-term complications, treating arthritis will prevent long-term problems, especially heart disease. So patients with arthritis, actually the most common cause of dying is not the joint pain per se, it is basically the heart disease which kills patients. And so it's very important to prevent arthritis.
Thank you for summarizing that so well. In fact, this is a common discussion that I have with many of my patients, where I tell them that you do need to exercise. They will say, I don't have any pain. Why do I need to exercise? So patients with rheumatoid arthritis are at double the risk of developing heart disease or stroke, where they can have a paralysis of one side of the body. Their risk is double compared to general population. So you do need to be careful with respect to your diet and exercise. And patients with rheumatoid arthritis tend to age much faster and have heart disease more commonly than other people without rheumatoid arthritis. So it is not just a disease of the joint, but many diseases in which arthritis occurs tend to affect other organs as well. So it's very important that we think about prevention, not only to make sure that the quality of life of the patient, that is, they don't have any pain, they don't have any problems or disabilities or damage to their joints, but also because so that they are able to live long and healthy lives. So we discussed why prevention is important, right? So then the next question on everybody's minds will be, is it possible to prevent arthritis?
Yeah, there's no direct answer here. It is both yes and no. I would rather put it that way. Yes, it is possible in certain ways to delay the onset or probably maybe in some cases stop the onset. But coming back to how arthritis actually happens. So arthritis or any autoimmune disease, there are two main factors which we already discussed in our previous series. One is genetic and one is environment. Okay, so somebody is likely to get the disease, ಕೆಲವರಿಗೆ ಕಾಯಿಲೆ ಬರಕ್ಕೆ ಸಂಭಾವನೆ ಇರಬೇಕು. Plus there is something which starts the disease or triggers the disease, which causes your immune system to attack against your own body. In case of arthritis, mainly the joints. So the genetic part is something which we cannot really modify. We cannot really change that. You are born with that risk, so you are likely, there's a chance of getting the disease. But that is not enough. Okay, so just because you have a risk of getting the disease doesn't mean you will get the disease. So just because there is some other member, family member who has arthritis in your family doesn't mean because you have the same genetic makeup you will get the disease. There has to be something else. Okay, so there has to be a trigger which we commonly think of as, like, say, infection. So commonly for rheumatoid arthritis it could be a dental infection or lung infection or viral infections. So that is one environmental factor, infections, which can trigger arthritis. And second is smoking. Okay, so smoking is also a known risk factor for arthritis. Then other environmental factors like pollutants, obesity. So patients who have obese are also at a higher risk of arthritis as well as severe disease. So these are factors which we probably can modify. So there are some factors which we cannot modify, which are not in our hands. Some factors which we can modify. So if we modify that, say you have a risk of arthritis, you are genetically predisposed because somebody else in your family has arthritis, you may be at risk. But by doing certain things or by modifying certain factors in your lifestyle, you may reduce the risk or probably negate the risk of developing arthritis. So yes, that's where it is. You probably can modify the risk, but the genetic factor is obviously something which you cannot modify.
Okay, that's very nicely put. When you were discussing about the things that we can do or the things that can lead to arthritis, and I think obviously those are the things that we have to prevent if we want to prevent the development of arthritis. You mentioned about obesity, and many times this is a little bit of a difficult topic to bring up with patients because there's a lot of stigma attached to obesity. The discussion about obesity itself can be difficult for many people. In addition to that, there is a lot of, I remember that with one patient whose weight was on the higher side, I kept having a discussion that you need to reduce your weight, and she kept saying that no, all of my relatives are saying that I'm losing weight, I need to actually put on weight. And she used to, every time she used to come and ask me medicines to put on weight, whereas I kept telling her that you need to reduce weight. So there's a lot of social pressure also not to lose weight. If you lose even a little bit of weight, all your relatives start telling you, oh, you're looking so weak, what happened, and all of those things. So those are definitely problems that patients do face when they think about losing weight. But one question which I commonly get from patients is that how does weight loss prevent arthritis? Is it that the weight is putting pressure on the joints, or is it some other factor by which being overweight leads to arthritis?
Yes, Sharath, and we face this commonly with our with patients where we try to address, apart from medications, what else can be done in terms of diet, exercise, weight loss, etc. First things first, yes, weight loss will help arthritis, will help to reduce the inflammatory burden, which will help your medications to act better. Just to give an example, we have seen patients. I had one patient who was obese, who had rheumatoid arthritis. His weight was 120 kgs, and he was on 4 different medications, and still his arthritis was not controlled. And subsequently, he went for certain treatment for his weight, for his obesity. He lost nearly 20 kgs weight, and definitely his joint pains improved. His medications reduced substantially. He was only on 1 medication, and he's doing well. So it's a clear-cut example for us that weight loss helps control arthritis better. Now coming to how weight or obesity is involved, as you said, 2 things. One, in disease like osteoarthritis, obviously it is the weight on the joints. Obviously, when we sit and on the ground and get up, nearly 6 times our body weight passes through our knee. So that is one condition where probably it may be involved directly as, because of increased weight. Those who are thin, they have less stress on the knee, obviously less likely to get osteoarthritis. Second, the fat itself is like an inflammatory site where it leads to inflammation. There are certain proteins involved which in the fat which actually increases the inflammatory burden. So reducing weight helps to reduce the inflammation in the body, and that helps to control arthritis indirectly. So weight loss acts in different ways in helping control your arthritis better, reduces the number of medications, and we see that day in and day out. Obviously, the challenge here, most patients also agree that yes, weight loss will be required, but the challenge is in getting the weight loss. I see that more as a challenge rather than patients agreeing to that weight loss will help or not. Most people do agree, but the challenge is it's a difficult thing to do weight loss and maintain the weight loss. That's where most people find that uphill task when we say weight loss. So weight loss, I think most people agree, but challenge is to do weight loss.
So that is interesting point, which I remember when I first learnt about it. Even I was surprised that it's not the actual pressure of the weight landing on the joint. Many times, I mean, that does add on in certain situations, but it's actually the fat. So as Dr. Vikram was saying, the fat in our body is not like a go down, which is just quietly storing fat or energy. It is an active participant in our body, and it is considered almost like an endocrine organ, meaning almost like your thyroid or almost like your pancreas, which produces insulin. The fat also produces a lot of chemicals, and those chemicals tend to increase your tendency to develop rheumatoid arthritis. In fact, there was a very interesting study which I read quite some time back, where, as you know, the incidence of rheumatoid arthritis in the West is reducing decade by decade. If you see 1950s, 60s, 70s, it is reducing slowly. And people thought that is because more and more women started using oral contraceptive pills. So as women started using that, they were protected from developing rheumatoid arthritis. But after 2000, so the graph was very steadily reducing from the 60s, 70s, 80s, down 90s. But after 2000, there has been a slow uptick. And when they saw what was the factor which determined that uptick or that increase in the number of patients who were developing rheumatoid arthritis, they found that obesity was one of the things which could explain it. So probably maintaining a normal weight is one of the best things that you can do to prevent yourself from developing rheumatoid arthritis or even osteoarthritis. Would you agree with that?
Absolutely, 100%. I'd agree with that. So obesity is now increasing not only in West but also in India. So with the abundance of resources now, we see, especially in urban setting, lot of kids are obese. And in West, obviously, it is a bigger problem. They have a significant amount of population which is obese, which are overweight. As you rightly put in, the fat is an organ in itself, which is also involved in a lot of processes, causes increased inflammation, and also a risk factor for arthritis, especially rheumatoid arthritis.
So I remember a very nice quotation from one of my professors. He said that becoming fat is like going on a highway, but losing fat is like traveling on a kacha road. So it's very easy to gain fat. Our body is designed like that. That is because as primitive men, as early men, we would not get food regularly. Like in winter, we would not get that much food, or if there were animals were not there nearby to hunt, we would not get food. So our body is designed that as soon as there are calories available, our body should retain that calories as fat, because we might not get calories later on, and the body can use those calories. So unfortunately, our body is designed in that way that we should our body tends to gain fat as soon as possible, and it is difficult to lose that. So many patients, when I pick up the topic of losing weight and preventing being overweight, they ask me what are the exercises I should do to lose weight. So what would you say in that kind of when a patient asks you that kind of question?
Yeah, so weight loss, unfortunately, we don't have very good medications for weight loss. Otherwise, it would be very simple for us to just prescribe a few medications and cause weight loss. But what has worked, obviously, is two things: diet and exercise. So diet has a very important role in weight loss. And now there are enough new research showing that certain weight loss techniques like fasting, etc., also helps in weight loss and helps in controlling inflammation. But exercises, if you could say, no specific prescription for exercises that you do this and weight loss. Obviously, having a healthy lifestyle, doing regular exercise, any form of exercise, It doesn't have to be a gym always. Trying to walking, yoga, running, cycling, swimming. So at least 30 minutes per day for at least 5 days a week, and 2 days some sort of weight exercise. So that would be something minimal should everybody should strive for. So having a regular healthy exercise regimen plus managing your diet with the help of a dietitian is the way to go for reducing weight. No medication as such, no shortcut we have. It is, as you said, a kacha road, which it is going to be a slow and steady process. But yes, these are proven methods for weight loss.
So there are many, you said that there are no medications for weight loss, and coming over to other things which we can do to prevent the development of arthritis. So many relatives of patients with rheumatoid arthritis, they tend to worry, because you also said that there is a genetic component to the disease, right? So they tend to worry that they might develop rheumatoid arthritis, and they commonly they ask me, is there any medicine that I can take to prevent the development of arthritis in me? What would have you come across situations where patients, relatives have asked you this, and what has your response been?
Yes. So not only patient relatives, but also I would add that nowadays, because we test a lot, so you go many times, you do some package of testing and in particular lab, and you find that some of your tests for arthritis is positive. And many times patients and the relatives come saying, I got so and so test done, this arthritis test is positive, so I don't have symptoms. Can I do something so that I don't get arthritis? Or as you said, many relatives of patients are worried that I may develop arthritis. Can I do something? Can I take some medication to prevent arthritis? The answer again is not very clear cut. There are a lot of studies. There are a lot of studies which have done, which have tried to look at, can we do, somebody has some antibodies positive for arthritis, but no symptoms of arthritis. Can we add some medications which probably will delay the onset or stop the onset of rheumatoid arthritis? Medications like hydroxychloroquine and rituximab has been used in this sort of setting. We call it as preclinical rheumatoid arthritis. Preclinical meaning before anybody has symptoms of arthritis. There's no joint pain, no swelling, nothing, but only test is positive. Test positive, no symptoms. Can we do something so that we don't get symptoms? So these studies have shown that they may probably delay the onset, or if somebody develops, say, there are studies, there's one medication called rituximab. Obviously, we don't prescribe this. This is all in research level right now. So this is not something which is used in common clinical practice. So which has shown that probably if it may delay, or you develop arthritis, it may not be that severe compared to if you are not on medicines. But again, this is not something which we usually prescribe for everybody. We take it on an individual basis. We assess, we follow up these patients. So the advantage of knowing that somebody has arthritis in the family, or you have a test positive, is that if you develop symptoms, visit your rheumatologist at the earliest. That is the biggest advantage you have. When you have symptoms, don't delay. You know that you may be developing arthritis, visit a rheumatologist earliest, who will evaluate you, check on you, and then trying to confirm if you have arthritis, and then start you on treatment. So because early diagnosis and early treatment makes a big change. But before you develop symptoms, there are certain medications, but again, not something which we usually prescribe for everybody. We follow them up closely. But at research level, there are some medicines which show that probably you can delay the onset, or if you develop arthritis, it may not be that severe. But not for everybody, not at present. Maybe in future, yes, we may be, we also want, so something like diabetes, somebody is borderline diabetes, can we do something? So similar to that, we may be, maybe 5 years, 10 years, 15 years down the lane, there may be some medications which we may be prescribing, say that, okay, this medicine will delay the onset or stop the onset. But as of now, not in routine practice.
Okay, so we are getting in a few questions. I think we'll try to take that in between. So Sri Satya Tata asked that I have steroid-induced obesity, which I find very difficult to reduce in spite of strictly following quantified nutrition and exercises. Any suggestions of reducing this stubborn fat? So, anything that you want to add?
Yeah, steroid is known to cause weight gain, and if somebody is on steroids for long duration of time for whatever reason, so that that has to be individually discussed by why they are on steroids for a long time, and can we bring down the steroids? Okay, so we want always to use the least possible dose for the least possible time, and that has to be discussed in an individual setting by why they are on steroids. Maybe it is necessary for them to be on steroids, so that has to be discussed with their physician or the doctor who's treating them. So one is the most important thing is try to reduce the steroids as much as possible. That is the probably the initiating factor which has caused. And apart from that, diet and exercise. But again, it's a difficult path. You are on medicines which probably is increasing your weight, but we are not able to completely get you out of those medicines. So try to discuss with your doctor if you can reduce or try to stop. It has to be, if somebody is on steroids for a long period of time, we cannot stop them suddenly. So I would not ask you to stop it suddenly. So try to discuss if it can be slowly brought down and try to bring down to minimum and try to stop it, because that will be an important factor. Apart from that, I'm not really sure anything else which we can
So
do.
one thing which has been shown to be useful in certain studies is a regular follow-up with a dietitian.
Dietitian, okay.
Many times people think that diet means, okay, I just need to avoid something. So that is not how a diet works. A diet is a 24/7 project. A 24/7 project. You need to think about what you are eating every time you eat something. So that is where a dietitian can help you out. And nowadays it's very easy. It's not like before. Nowadays we have good qualified dietitians and they're available on apps. So you can just message WhatsApp or message your dietitian and they can get back to you and say that instead of eating this, eat that, or this thing. And there are a lot of new research which have been done on obesity in particular, and they have found ways in which you can avoid obesity. So there are a few simple tricks and tips that the dietitians can tell you, which, trust me, makes a huge advantage. For example, the color of the plate. So research has shown that if the color of the plate is of a different color as your food, for example, if you're eating rice, then if your color of the plate is black, or if you're eating chapati, then if your color of the plate is red, that will make a difference to the amount of weight that you're able to lose, because the contrast that it gives helps us to reduce the amount of food that we take in. Second, the size of the plate. The smaller the size of the plate, even if you have to take 2 times, 3 times to fill your stomach, the smaller the size of the plate, the less food that the person takes in. So there are many such tips and tricks which have been found to be very useful based on good research which has been done in the last, let's say, 5 to 10 years. And I'm sure any dietitian who is aware about all these good research will be able to give you those kind of clues to help you with respect to losing weight. So the important message here is try to come off the steroids if possible. Be persistent, don't lose hope, and be regular or be consistent with a dietitian. Next, Banu Prakash asks that he's having back pain and who he should consult. Okay, that is not actually related to the topic, but Banu Prakash, you can consult a rheumatologist or a physiotherapist or an orthopedician or even a family physician, and they should be able to help you out. Harsha Kumar asks, is rheumatoid arthritis linked to family hereditary? So Dr. Vikram answered that initially itself. He said that there is a significant family history risk which is there, or a hereditary genetic predisposition. But just having a family history is not enough. There is something else, and those things we can affect. So Mr. Ricky is asking about HCQS induced pigmentation. If that is a problem, Mr. Ricky, you can always talk to your rheumatologist. There are other medications that you can take instead of HCQS. Hari Gopi says that her husband was taking a lot of tablets before, but now he's taking very few tablets and he's feeling much better. Good to hear that. The other question by Somya is about gout and regarding how long he has to take the medication. So for that, Soumya, it is varies according. It's not relevant to the topic we are discussing, but just to answer your question, it varies according to your particular situation. So better you discuss this with your rheumatologist in person. That would be better. So coming back to the discussion, we were discussing about how we can prevent the development of arthritis, and we talked about weight loss. We also talked about medications. And to summarize, you do need to lose weight. Diet is very important, and that's one of the best ways to prevent the development of arthritis. With respect to medications, at this point, there is really no answer, good or easy answer to that. There is a lot of research which is going on. Maybe in the next 5 to 10 years, we might have a medication, but at this point, there is no medication. Definitely not something which can be offered to everyone. The third important question that everybody asks when discussing prevention of arthritis is there any food stuff or any particular food stuff or a particular diet which can prevent rheumatoid arthritis? So I commonly tell patients that there is something called as a Mediterranean diet. Would you want to elaborate on that, Dr. Vikram, on Mediterranean diet? Okay, so Mediterranean diet is something which has been proven again and again to help not only to reduce your burden of inflammation, that it is able to reduce the amount of inflammation that you have if you have rheumatoid arthritis. It also helps your medication such as methotrexate work better, but it has been shown to prevent the development of rheumatoid arthritis if you are at risk of developing rheumatoid arthritis. So what is a Mediterranean diet? So the Mediterranean Sea is the sea which is there between Africa and Europe, and all the countries around the Mediterranean, that is the Spain, Italy, Greece, those countries, Cyprus, all of them have a particular type of diet, and that diet in research study after research study has been shown to be very useful. One, for the prevention of heart disease. It has also been shown to be useful for diabetes, and now it has also been shown to be useful for the prevention of rheumatoid arthritis. So what does the Mediterranean diet mean? So Mediterranean diet means that there is very few processed foods. So none of the packaged items, none of those items with a lot of sugar in them, none of the things which are deep fried, those things are absolutely out. All of them are out. So what does the Mediterranean diet include? It includes a lot of fresh fruits and vegetables of different colors. So there are a lot of greens, there are a lot of tomatoes in a Mediterranean diet. In addition to that, people who follow a Mediterranean diet consume a lot of olive oil. In fact, here and all, it's very common to order gobi manchuri and paneer tikka as a starter. But when I went to Italy, one of the most common starters over there is just olive oil and bread. So they just, with the bread, they just mop up the olive oil and they eat it. That's it. So that itself is something that they use or consume very commonly. And in addition to that, they take a lot of nuts as well as oily fish. So what are oily fish? Tuna, sardine, mackerel, cod, these are the oily fish which are there. So a lot of fresh fruits and vegetables, usage of olive oil, nuts and oily fish. These are the 4 components of Mediterranean diet, and study after study or research after research has shown that it is very useful for the prevention of rheumatoid arthritis. So we discussed about weight, how to prevent rheumatoid arthritis by maintaining a healthy weight. We discussed about medications, and we discussed about diet. So are there any other things that a person can do to reduce their risk of developing arthritis?
Yeah, one thing which we need to also discuss is smoking. So smoking is an important factor for development of lot of diseases, and especially for rheumatoid arthritis. And it has been proven beyond doubt that smoking helps in initiation of rheumatoid arthritis and also maintenance of rheumatoid arthritis. In Western countries, obviously smoking, both men and women do smoking. In India, women not much. But still other forms of smoke also, maybe in rural population because of not much common now, obviously with use of LPG, but still there are places where they use burn wood and other things. So smoke in any form is an important initiator and a trigger for rheumatoid arthritis. I was talking about genetic and environmental factors. So smoking is an important environmental factor for smoking, and stopping smoking is something which we would suggest all patients who smoke. If even if patients, there are other people who are smoking, obviously passive smoking is also a concern. So trying to reduce that also helps to control your arthritis, or prevent arthritis. So if you are susceptible to arthritis, one thing which you should not be doing is smoking. So all those, obviously, apart from the other problems with smoking like cancer and heart diseases, arthritis is also an important thing which should need to be kept in mind, and something which you would suggest all patients and also relatives of patients and overall in general to stop smoking.
Okay, thank you. That was very nicely summarized. So we have a few more questions. I think we'll try to address them as time is running out. So Sadanand Pillai, he says that he finds it very difficult to sit on the floor and get up, and whether because of pain in both knees, and whether this is due to arthritis or due to obesity, and that he's finding it difficult to lose weight, and how should I reduce my pain. So first of all, Sadanand, you should meet a rheumatologist who can take a comprehensive view of all of the problems that you're facing and definitely suggest treatment for that. This session that we are having today is part of the World Arthritis Day program by the Indian Rheumatology Association, and the theme for that is arthritis is treatable. Though we are talking about prevention, the fact is that many patients do not take treatment for rheumatoid arthritis because they feel that it is just do not take treatment for any type of arthritis because they feel that it is just a disease with pain, or it is just a fact of old age or something like that, where that is not true. Arthritis is a disease and it can be treated and it should be treated. So arthritis is treatable is the theme of this World Arthritis Day, and therefore I would advise Sadanand Pillai also to meet a rheumatologist. Now, with respect to his pain, it is definitely due to knee arthritis, which has occurred probably due to obesity. So, losing weight will be helpful and will be an important part of the treatment of your condition. But apart from that, obviously, you will need a more comprehensive treatment, which any rheumatologist should be able to help you out. Mohammad Irshad says that he has seronegative arthritis and he is taking various medication, but his knee pain is not reduced. So he is asking with respect to specific medication. This is not the correct forum to address that, Mohammed, and therefore I would suggest that you have a one-on-one discussion with your rheumatologist or any other rheumatologist, and they should be able to help you out. Soman Gowda says that my mother is 65 years old and she is under treatment. Despite being on treatment, she gets some pain. So, Soman Gowda, that is unfortunately not too uncommon. Many times research has shown that the treatment of patients with arthritis can be not as optimal as patients want it to be. Some patients can have persistence of pain. Am I right?
Absolutely, absolutely.
So, what would you suggest to Soman Gowda?
Yeah, so Soman, pain can be mainly due to two reasons. One is if the disease, like underlying arthritis, is active, or there is some damage because of the arthritis, or some wear and tear like osteoarthritis, which we call. So knee pain would be, it has to be, first and foremost, we need to know what is the cause for pain. Is it active disease? Is it some amount of damage because of the disease, or something called as osteoarthritis? And then manage that. If it is because of active disease, we need to probably increase your medications or add certain medications. That would be decided by the rheumatologist who's treating that. Or if it is because of damage, then we would suggest certain physiotherapy exercises to strengthen the muscles, because the weakness of the muscles is an important component because all the strain is on the joint. So strengthening of your thigh muscles or your hip muscles would be very important. So if it is because of damage, obviously we would want to do some physiotherapy and maybe some pain medication initially, which would help to reduce your pain. So based on what is the underlying problem, the treatment has to be addressed accordingly, and definitely we should be able to help out with that respect. So we can optimize the treatment in that aspect.
So I hope that answers your question, Soman Gowda. And Sri Satya Tata asks that are there any nutritional supplements that can help in preventing arthritis?
Yes, so as we discussed with the Mediterranean diet, so basically the supplements are useful when there is some deficiency of certain things. But one thing which is known to help the immune system is the vitamin D. Apart from the other than that, I'm not sure if any other supplement is really useful, though it is widely publicized and widely there's a lot of hype. Overall, vitamin D definitely helps to keep your immune system in good health and probably helps in certain ways to keep your bone health better. So if you are deficient in vitamin D, definitely vitamin D supplements would help. Apart from that, more God-made food rather than man-made food is enough. If you're having a balanced diet, that is more important rather than any supplements. So having a balanced diet is more important because there's a lot of myths saying you don't eat this, don't eat that, and patients end up avoiding lot of food, avoiding getting lot of deficiencies, and the arthritis is causing a lot of fatigue and weakness, and that itself the dietary restrictions adds on to that. So it's more important that you consume a balanced diet meaning proteins, carbohydrates, minerals, vitamins, so all should be there, but try to avoid processed foods, more man-made food, and one supplement which may help is vitamin D supplements. If you're deficient, definitely you can take that.
Absolutely, absolutely. So the best diet is a balanced diet and a natural diet, as you put it very nicely. God-made food is what we need to take in, and man-made food is what we need to avoid. Though nowadays it's very difficult to avoid man-made food. It's everywhere, all around us. The temptation is very high. And unfortunately, God-made food has become very expensive. Man-made food has become very cheap. Biscuits are so cheap, but just to eat an apple, you need to pay so much money. But the research is very clear that it is the man-made food which leads to these problems, especially arthritis, and it's the God-made food which actually helps us to protect ourselves from them. So Vinod asks that whether you can adopt other systems of medicine like homeopathy, Ayurveda, or naturopathy. Vinod, we are both of us are doctors who practice conventional medicine, and therefore I think it would not be right of us to comment on this. I think better would be to ask that question to a homeopath. So Radhesham gives a shout out to Dr. Vikram Jain, saying that it's very great to hear you. So nice to see that you have so many fans.
Thank you so much.
Harsha asks a very pertinent question, though it is not the topic of discussion. He asks a pertinent question. He asks, how do you identify whether a pain is due to a normal pain or whether it is due to rheumatoid arthritis?
Yeah. So very good question, Harsha. So when a patient has arthritis, there will be signs of, when we check for signs of something called as inflammation. So there will be, apart from pain, there will be swelling, there may be redness, there may be increased warmth. So many a times we look for these signs. If you're not able to find, sometimes we use the help of certain tests like blood tests, like ESR, CRP. You must have seen your doctor advising these tests. Or sometimes we look using certain techniques like ultrasound or MRI, where we look for inflammation. So if we find evidence of inflammation by checking the joint, or we find evidence of inflammation in the blood test or on imaging, we attribute the pain because of inflammation. But when there is no such signs on checking, or if the inflammatory parameters are normal, or if on ultrasound also it is negative, or if there's evidence of damage on imaging, then we would more likely attribute that to, apart from inflammation, maybe damage or something called as fibromyalgia, where there is increased sensitivity to pain in patients of arthritis. Patients of arthritis can have associated, because of long-standing pain, because of factors we don't understand, there is an increased sensation of pain all over the body apart from the joints itself, which may be a reason for the pain. So that has to be evaluated by the doctor concerned, and they will be able to help out in that situation appropriately.
So I hope that answers your question, Harsha. So basically, what Dr. Vikram is trying to say, if I can paraphrase, is that there is no simple answer, and you do need to take the help of a rheumatologist to help figure out whether your pain is just a normal pain or a pain due to rheumatoid arthritis. But three things which are not, you cannot hold them as sacrosanct, and like you cannot say that they can always help you to differentiate between both of them. But three things which can help you differentiate is if the pain is worse in the morning, right? And it's associated with stiffness which lasts for more than 30 minutes, right? That is point number one. That is more likely to be rheumatoid arthritis related pain than any other pain. The second is if the pain worsens with rest. So even in the afternoon, if you sleep for a while and then you get up, the pain gets worse. And the third thing is if the pain improves with exercise. So you will see rheumatoid arthritis patients saying that they're in a lot of pain, but if they keep moving their hands, they feel better. So these three things can help, but ultimately, as Dr. Vikram said, the only way that you can with confidence differentiate whether a pain is due to rheumatoid arthritis or due to some other reason is by meeting a rheumatologist who can take a comprehensive view of it, not only what you are experiencing, but also examine you and also see the investigations and then tell you that your pain is due to rheumatoid arthritis or due to some other reason. So we have already exceeded the time, but I think there's one last question which we can also answer, and that slightly touches upon prevention as well. So Maheshwari asks, is rheumatoid arthritis or is arthritis more common after delivery in women?
Yes, I think that's a very nice question. Yes, we do find patients after delivery coming with starting of arthritis. And obviously, why arthritis is more common in women is because of some hormonal differences between men and women. And because of these hormonal changes, especially after delivery, we find that many patients, many women do have a starting of their arthritis. One more thing which happens is if somebody already has arthritis, the arthritis in 50% patients actually comes down during pregnancy because of some hormonal changes again, but which may actually increase after delivery. So this is known to occur. This is something which we see regularly in the clinic. Many women come with the arthritis, starting of their arthritis after delivery.
So if just to highlight that fact and re-emphasize it, so patients who are predisposed, who are going to develop arthritis, tend to develop it after delivery because there are hormonal changes which occur at that time. But probably that is the main thing that we need to remember, right?
Yes.
So during pregnancy, again, because of different hormonal changes, the arthritis can become inactive. But after delivery, once all those pregnancy-related hormones go away, then the arthritis can come back, or if they don't have arthritis, it can start off at that time.
Yes.
So Sri Satya Tata says, thanks a lot for this session. You're most welcome, madam. And I hope the rest of the people also, this session was useful to the rest of the people who were attending, and also anybody else who's going to watch this video. So this session was basically conducted to increase awareness about arthritis and the factors that can lead to arthritis and what we can do in our daily lives to prevent the development of arthritis. It is part of the World Arthritis Day program, which is being conducted by the Indian Rheumatology Association, and the main theme of this is arthritis is treatable. If you or your loved ones, any of them have arthritis, then make sure you approach a doctor, preferably a rheumatologist, and take treatment, because there are very good treatments available nowadays. So with that, I think we can conclude this session. Any concluding remarks, Dr. Vikram?
Yes. First and foremost, as Dr. Sharath put it across, arthritis is treatable. Please don't be disheartened if you're diagnosed with arthritis. Please consult a rheumatologist and take a regular treatment, which definitely ensures that your arthritis is under good control and you can get back to normal life. But in terms of our session today, in terms of prevention, which we talked about very important points, have a healthy lifestyle, have a balanced diet, lose weight, try to work on losing your weight, stop smoking. So there's some things which you can take away in your regular daily lifestyle, not only for arthritis, but overall is to have regular exercise, have a balanced diet, stop smoking, and try to lose weight. So that would help to prevent or delay the onset of arthritis. That's it.
Thank you so much, Dr. Vikram. That was a very nice concluding remark. With that, I'd like to say goodbye to everybody who's viewing. And I hope you will continue to attend these sessions, which we hold on the 10th of every month on various topics related to rheumatology as well as related to general health. Thank you all, and see you on the 10th of November.
Thank you.